Speakers, I'd like to invite Deborah Markenson, who's moderating this session.
Good morning. Good morning. Thanks, Shelley. As Shelley said, I'm Deborah Markenson. I was with the Weighing In program a few years back. I'm in my second retirement. My first real job, or second job, was with the State Health Department, and I happened to spend 35 years there, so I'm one of those public health cult kinds of folks. And as Dr. Cole and I were speaking right before we started, now that I'm on my second retirement, I'm an aspiring artist. And he used the adjective despairing artist, which is descriptive when you're an aspiring artist, but it makes me think that perhaps one of the strategies we need for the pandemic that Dr. Cole so aptly described is we do need that movie. So those of you who want to work with me, we can think about the screenplay, the cast. I don't know, Dr. Cole, are you somewhere between Tom Hanks and some other actor? We'll work on that. We probably need to think about, instead of the helicopter rushing in, those of you in active transportation can identify the most dramatic approaches to cover those bases. But I think that would just be another strategy that can employ to bring some attention to the issues and the importance of this issue. So let me just set the stage for this panel discussion. One of the projects that I had the privilege to participate in was one that Dr. Hampel and Dr. Whiffley really spearheaded, and it led to our efforts to look at these issues from a systems perspective. So for the next hour, we're going to focus on the treatment side of things, because we clearly recognize the value of the systems approach. We clearly recognize the importance of the preventative strategies that we have outlined. But in the meanwhile, we have a significant proportion of our population that already have obesity. We have a significant proportion of children that are experiencing adult chronic diseases simply because of the physical inactivity, because of the food issues, because of the extra weight that they're carrying. So we felt, and our two co-chairs are strong advocates that felt that this was an important issue for us to take forward. And so through their efforts, I'm going to give you some overview, just to, as I stated, to lay the foundation. I want you to make sure that you understand the 5 recommendations that we came up with, although we'll focus our time on the treatment recommendation. We're going to look at the plethora of evidence to support the treatment aspects. We're going to look at some of the policy considerations that are being taken under consideration by our state Medicaid agency, so we're lucky to have such grand leadership there to help us and work with us. We're also going to look at, while we may change the policy for reimbursement for coverage for treatment, if our workforce and our health force isn't ready to deliver that, that's a dilemma, so we're going to talk about what we're doing to address that. And then we're also going to give you just a few snippets, few teasers on that broader set of 5 recommendations and some of our efforts to integrate the prevention strategies with the treatment strategies. Okay, a little background, and okay, the problem, we've already talked about this. Unfortunately, this is one of those lag slides, so it's going to take far too long in this delayed clicker, so we'll just click through those. From the perspective of our subcommittee that was established by the Missouri Children's Services Commission, that is a state group that's convened with members of the Missouri General Assembly and representatives from all the state agencies to look at children's issues and identify concerns and issues. So through that, we brought to that group, or Dr. Whiffley and Dr. Hampel brought to the group the concerns that they had for the lack of treatment access for children who had childhood obesity. And the Children's Services Commission wanted to set up a subcommittee to really study this and look at this. And so they also asked the subcommittee to look at not just treatment, but the prevention strategies as well. So we framed our discussions to address some key problems that we identified that are alive and well in the state of Missouri that really look at it from a systems perspective. Now, obviously, these problems are happening within the broader context issues, the health inequities, the social determinants of health, the obesogenic environment, the food insecurities. So those are big, broad issues, but we chose to clearly keep our efforts focused on some of those state policy issues that we felt that we could get more of a handle on. And you obviously know the results of all of these issues lead to the fact that we have far too many people that are in the overweight, obese category, leading to the chronic diseases, leading to the costs that we have for providing health care. And as I stated, we are focused on those issues that were a statewide policy. So there was a broad group of stakeholders that were convened. We were able to secure a facilitator and a report writer to help us have this discussion, so thanks very much to the Missouri Foundation for Health, and as well as the Healthcare Foundation. They gave us some seed money to start that process. The subcommittee was convened in 2014, drafted recommendations, and an important part of the process was that we took these draft recommendations out to 4 public forums across the state of Missouri to get that community input and feedback to help finalize those recommendations. And we also wanted to share with the group some criteria that we had to also define the parameters for what we were going to tackle as part of this report. Because as we have learned from the systems approach that we've all been chatting about, there are about 8,000 options that we have in areas. So we wanted to keep this into a manageable number. So we looked at those issues that were actionable by the state legislature or government that we could implement within a realistic time frame. We initially said 2 years. Well, 2 years in governmental work and collaborative work means at least 5. So we're still within that time frame. We wanted to make sure that our recommendations were clearly evidence-based, as well as have potential for statewide impact. And so it resulted in a report. There's a link so you can go and see the full report. It has the recommendations spelled out, as well as documentation and the rationale behind each of the recommendations. So at this juncture, I'm going to invite Denise to come down and share with you how did the evidence really lead us to this juncture in Missouri and give us the basis. And we are so fortunate to have Denise in our state. She is the Scott Rudolph University Professor of Psychiatry, Medicine, Pediatrics, and Psychological and Brain Sciences at Washington University. She's also a principal investigator on multiple NIH studies and has gotten more than $35 million in continuous funding over the years, is internationally recognized for her expertise in not only obesity treatment for children and adults, but eating disorders, and is a tireless advocate for taking this rich research base that we currently have and helping us translate it into actual practice, which is not a small feat, as we have all have come to appreciate. So at this juncture, help me in welcoming Denise down here to share. If you point it